And like we all know, Pink October is just around the corner. Today's the 30th of September. Tomorrow will be the 1st of October, and we will be officially welcoming Pink October. It's the month in the entire year dedicating to pushing harder the awareness of breast cancer. We do push the awareness of breast cancer on a regular, okay? But in the month of October, we put in more effort. In fact, we call all and sundry to be part of the Pink October, awareness of breast cancer. But we don't need to wait till tomorrow being October, or the beginning of October, before we start the conversation on breast cancer. And so today being Tuesday, which is Good Living Day, where we talk health right here on Prime Morning, it's highly important that we begin the awareness of breast cancer. My name is Cynthia Akli-Nartey, and this morning I am joined by a breast cancer survivor, and not just her. Well, let me just properly introduce her to you. So she is Mrs. Joycelyn Yawokuma, and she's a critical care nurse as well. And then also we have Dr. Cynthia Akli-Nartey. Please, I hope I didn't butcher it. We're good. She's a specialist, a surgeon general, fellow in training, general surgery. Good morning to you.
Good morning.
Good morning.
Hope you're well.
Doing well.
Yeah, blessed.
Today, we are going to talk about your story. Today, we would love for you to open up a bit, some more, and let us in onto your journey. And, Doc also being here is going to help us understand certain things as well when it comes to breast cancer. So please, viewers, I want you to hop onto our Facebook page, which is Joy Prime. If you have any questions in relation to breast cancer, do not hesitate to send it to us and ask us, or you can take our WhatsApp number 055-157-5757. Now, reading about breast cancer, I was alarmed to have found out that is the second most leading cause of cancer deaths here in Ghana. I mean, after liver cancer. And I know that breast cancer we have pushed the awareness so much in Ghana, and I wonder if it's even enough, if the job is being done properly. What could be going on wrong? Because we still have a number of cases where they end up being diagnosed at their advanced stages, and then you would wonder, what could be going wrong? So, Doc, let me first come to you and help us really understand. I know, yes, let's give us a pat on the back, because we are doing well, aren't we?
Yes, we are.
Yeah.
We are doing well. Nowadays, we do not wait for just Pink October to make the awareness of breast cancer. We do it all the time, and then with more emphasis on it during October to get the information out there. We are doing well, but there's always more room for a lot to be done.
Right.
Because as of now, still in the clinic, when I sit in the clinic to see patients, I see patients who come with very advanced stages of breast cancer.
Very advanced?
Yes, very advanced, such that at that point, we cannot cure them.
Aye.
And all we can do is just to manage their symptoms, what we call palliation, because the cancer would have spread to other parts of their body. Yes, we still see quite a number of patients in that stage. And most of them come in that stage because, not just because they do not know or haven't heard at all, but for fear.
Of finding out that it could be breast cancer.
Exactly. Fear of finding out it could be breast cancer. Others also seek alternative therapy, like herbal medicine. Some use fruits, some use veggies. Exactly. There are people who go to church to be prayed for. Not to say the spiritual aspect is not important, but the best thing is to combine the two.
Yeah.
And then you can get the best out of it. And they come in very late stages, such that we cannot do so much to help them. Often it's quite heartbreaking.
Yeah.
But yeah, that's the picture we see.
Before Josephine comes in, speaking about, very advanced stages that, sometimes you would have to record. How do you manage their emotions? How do you manage breaking the news to them? How do you manage them understanding that, yes, this may be the situation, it's very advanced, but it doesn't mean that, you're going tomorrow or something? How do you do that?
So the management of breast cancer is a multidisciplinary approach.
Okay.
They're not managed by just doctors or surgeons.
Okay.
So we have the psychologists involved.
Right.
We have the breast care nurses involved,
Okay.
who are able to relate with the patients at the level they will get things. They're able to communicate with them daily, on a daily basis. They don't just talk to them. We have the palliative team also get involved, talk to family, help break the news and all that to them. So we have that available for patients, yeah.
Josephine, now your story. How did it start on with you?
All right, so it started in the month of November 2019.
Okay.
Just after Breast Cancer Awareness Month.
Yeah.
And I never checked my breast before then. I thought I was young, though I had the knowledge as a nurse. And then I will walk through the surgical OPD to my department. I was working at the Kwalebu ICU. But then I felt I didn't have a family history. I was young, so I had nothing to do with breast cancer. So I never checked my breast. I never did a mammogram. Then the first week of November, just after the awareness, I was lying on my bed and I would say, Grace, I just touched my breast and I felt a lump.
Well, okay, so is it that you were feeling pain?
No.
But you just decided to...
I don't know exactly what happened, but then I was on phone with my husband.
Okay.
So I just put my hand on my chest and then I felt that there was a hardening. It was not painful. It was very, very tiny, less than 2 centimeters when it was removed. So when I felt that lump, I told him that I feel a lump in my breast, and he was like, when you go to work tomorrow, just go and have a check. So when I got to work, I discussed with a few of my friends, and I had weaned my baby off milk 2 months prior to this lump appearing in my breast. So most were like,
maybe... So I would say that you had freshly given birth.
I've given birth, yeah, that was my 3rd child.
Okay.
And I'd weaned him off milk like in September.
Okay.
And found this lump in November.
Oh, okay. Okay.
Okay, so most of my colleagues were like, maybe it's because of I just weaned off my baby, so it could be nothing. So I waited for about a week before I saw a doctor who examined and was like, no, this one, I need you to do a scan. So when he
okay, so do not continue on that bit. I want Dr. to address this part for me about, you know, the part where you weaned your baby off breast milk and all of that. We have had a number of nurses, doctors come in here and talk about the fact that when your baby is sucking onto your breast for breast milk, it lessens your chances of getting breast cancer. Yeah. So what is the probability in her situation like?
So it's not cast in stone.
Okay.
Okay, breastfeeding offers some protection, but that does not mean if you are breastfeeding, you cannot get breast cancer. Okay, it offers some protection. The data has shown that it offers some protection, but that does not mean you cannot get breast cancer. Because we've seen a number of patients, I might not be able to have specific numbers,
right.
I've seen a number of patients who develop breast cancer even during pregnancy, which is also noted to be protective. Okay, or during breastfeeding. So if you notice a lump in your breast during pregnancy or breastfeeding, don't just assume it's due to pregnancy changes or it's due to breastfeeding changes. Yeah. The best thing is to see a healthcare worker to get examined, investigated, and then we can all be at peace that there's nothing going on. If there's something going on there, then we can tackle it early. Exactly.
Beautiful. Josephine, please go ahead.
All right, so the doctor asked me to take a scan. And that was done. So just a normal breast scan, just like we do the ultrasound for pregnancy, was done. And it picked that there was some malignancy, there's some cancer in there. I didn't end there, so I had to do a biopsy. So I did a biopsy, and it confirmed that it was breast cancer. So.
And you said it was, what was the size?
Less than 2 centimeters after surgery. After it was incised, it was less than 2 centimeters. It was painless. There was no pain. It was just there in my breast.
When a girl is growing up and she starts developing breasts, there's something in there, right?
Yes.
How long does that stay in your breast as a girl or as a woman?
So there's a breast bud. Okay, there are stages of breast development, and there are a bit of individual differences. Okay, not to be too technical. There's a stage 1, stage 2, 3, and 4.
Okay.
By the time you reach stage 4, the duct might not be as, the bud might not be as prominent as you feel it when you are young.
Okay.
But it's still palpable. As healthcare workers, when we palpate and we notice that it's that, we know it's that. If there's something different in there, occasionally too with investigations like the scan she mentioned or mammogram, is also able to pick up any of those differences. Yeah.
Okay. Okay, so till what age do you have that in your breast?
As I said, individual differences. There are
Individual
people who start developing quite early, and there are people who also start developing quite late. But looking at the change in our diet and stuff now, now you have younger girls getting to starting their menses and stuff quite early. Yeah, so there are a bit of individual differences.
All right. So after, you know, I would say that you didn't have to go through so much, you know, be it pain and all of that. You didn't have to go there because you got to find out at the early stage and you had it removed on time.
Yes, please. But then I had to do treatment too.
Okay, so help us understand that.
All right, so for treatment of breast cancer, we have surgery, chemotherapy, radiation therapy, then other treatment, depending on the type that you have. So we don't have we have a big umbrella, which is breast cancer, but under that, we have help me out.
That's subtypes.
Subtypes, good. So the type you have will determine your treatment plan.
Okay.
Okay, so I started with surgery, and the lump was removed. The breast was conserved because I found it early. All right, then I proceeded to do chemotherapy. I did 6 cycles of chemotherapy. Then I did radiation therapy for 15 days. I'm currently on medication to prevent the cancer from coming back, and I've been taking this medication for the past 5 years.
Okay. Okay, so your breasts are still intact?
Yeah, these are my real boobs.
We wanted to be sure of that part.
Yes.
One of the fears that I know that a number of women have is there's this assumption that, the moment there's a lump noticed in your breast and you go under the knife, it means that your breast is being cut off.
Yeah.
And so I want you to, Doc, help us, go through that stage of, like, the way Josephine is still beautifully seated with her, her natural breast and everything. Let's go through the stages and understand.
All right. So if breast cancer is identified early, say stage 1, stage 2, and the size of the lump compared to the size of your breast is small, the lump can be taken out.
Okay.
And your breast is conserved for you. But afterwards, you have to have mandatory radiotherapy. Okay. And then you can, if you didn't have chemotherapy before the surgery, you have chemotherapy after. And then you might be put on some tablets like she has been taking for the past 5 years. Okay. But if you present late, or when you notice the lump was quite big, say about 5 cm and bigger, then it's quite difficult to conserve your own breast for you, okay? So we might need to take off the breast, but that is not the end of the story.
Yeah.
Our plastic surgeons are doing amazing things for us right now. They are able to reconstruct the breast. Okay. There's breast reconstruction, okay? You're able to do nipple reconstruction and all that. It might not be similarly perfect like your natural breast, but you have something.
Something
that's something you can dress with, feel good when you look at yourself in the mirror.
Yeah.
Taking off your breast is not the end of it at all. There are implants that you can have put in, the silicone implants you can have put in.
Yeah.
Others still don't want any stress. They just get a foam, put it in their bra, so that when they dress up, you just see the amount over, then they are good to go.
Yeah.
Yes, there are different options. The fact that we have to take off your breast doesn't mean there's nothing else. You have to move with a flat chest.
So the only instance that your breast would be cut off is at the advanced stage.
Yes.
When you do the test and it's found out you're at the advanced stage.
Yes, and the size of the lump as well.
Okay, the size of the lump.
Yes, the size of the lump that's identified.
So with Josephine's situation, Joycelyn, sorry, I keep on calling you Josephine, I don't know why. Joycelyn, so with the size of the lump that was found in her breast, did you have, I want to know if maybe after it was removed, it changed your breasts in any way? Was there any difference as compared to your breast before?
No. So I have a scar on my breast.
Okay.
Initially, you can see that that particular breast was a bit smaller. But then by some, maybe anatomy, everything is now, you know, you can't tell from looking at me right now which breast.
You can't.
You can't. So you can't tell which breast had it.
Which breast had it though?
This one.
Okay.
Yeah.
Okay.
So it's all normal size. There's no foam, there's nothing. It's just my normal breast. Yeah.
But you've been on medication all these years, isn't it?
Yes.
And I wonder how long you have to be on medication for.
10 years maximum.
10 years maximum?
Yes, that's for hormone-sensitive breast cancer.
Why? How is that? How does that work?
Because, as we mentioned, there are subtypes of the breast cancer. There are what we call the immunohistochemistry of the breast cancer, where we see if it has estrogen receptors and progesterone receptors. Okay, if it has any of these receptors, then we'll put you on hormonal therapy. That's medication to block the action of the hormones, because that can progress, make the breast cancer progress or get a recurrence. So these medications help to block the action of the hormones.
Right.
And you need to take it for a maximum of 5 to 10 years. Yes.
So blocking the action of the hormones, does it not affect any other part of your body in any way?
It does.
It does?
It does.
What does it do to you? What have you experienced so far, if you would love to share?
All right, so you can get memory fog or brain fog, like you lose your line, like as I was trying to bring out the subtype.
Yeah, remember a word?
Yeah, yes, so you have that. Then it affects your sex drive.
Your
sex drive.
Oh, your sex drive.
Yes, that one. Then there are others like.
So you know, I believe that the moment you said that, I'm pretty sure that a number of people are highly interested in that bit a little bit more.
Okay.
So let's delve deeper, okay?
All right.
The sex drive bit, meaning that how you used to have the urge.
Yep.
To want to have sex.
Mm-hmm. It's affected, so it's reduced.
It's reduced.
Yes.
Ooh.
Yeah.
Wow.
Yes.
And your husband, how is he? How is he taking everything?
We are managing. We are coping. Yes, that's
you need to have a very understanding partner.
Yes.
You need to. And I love the part where earlier you said that, when they are being spoken to, it's not just them, but then their family members. So the people around you are roped into it as well.
Yes, exactly.
Because everybody has to understand your situation.
Yeah.
How has your husband been taking this?
Very supportive.
Very supportive.
Yeah.
Beautiful. So, okay, what else is affected? Brain fog, sometimes your sex drive reduced, I would say. But at least cacao. I want us to understand that bit.
Yeah, so unlike before that, maybe just a normal touch can turn you on. This time, you need to do extra work.
Extra work.
You need to, maybe from morning, start tuning your mind towards the act. And it's like, it's work. You need to plan to enjoy it. Unlike first, you just press a button
and then it goes.
It doesn't work down.
It's the whole construction work. Oh my goodness. It is well.
And
but
sometimes it doesn't work at all.
At all. Do you mind me asking how old you are?
No.
Let's just.
I'm 40.
You're 40.
Yeah.
Okay. All right. Now, Doc.
Yeah.
Does this differ from situations when it comes to breast cancer, or the level or the amount of hormonal medications that you take, depending on your case?
So if you are hormone sensitive, it also depends on your age, whether you are premenopausal or postmenopausal.
Okay.
you are premenopausal, you get a different medication because your ovaries are still functioning and producing estrogen. So you need to block the receptors where the estrogen will go and act. If you are postmenopausal, most of the estrogen you get is not from your ovary. It's from the periphery, like from fat conversion and all that. So we block that conversion, okay? So, and that also has its different side effects. Mainly bone pain. They get mainly bone pain. You know, post-menopause, most women actually complain of that because you need estrogen to help with the structure of the bone. But now the estrogen is not being produced as much. And even the little that is being produced, we are blocking it with medication. So they mostly complain of bone pain, but there's medication to help counteract that as well,
Joycelyn, what are the effects?
You easily get tired, fatigue.
Okay.
Yeah.
Okay. But I believe that's it. That's all.
It's manageable. Or there are other side effects, but then you may not experience everything.
Yeah.
And you know the doctors, sometimes when you complain, they refuse to accept that it's a medication you are taking. They wouldn't want you to associate everything to it, so that you decide that, okay, I'm not going to take this medication again, because you really need it.
You need
to prolong your life. So so basically there are a few others that are insignificant that you can just live with. So we don't.
We want some more juicy details about some of the happenings in relation to all of these side effects that you've highlighted.
All right, so about the fatigue or weakness, I exercise to help with that. So I decide that, okay, in a week, maybe I take short walks just to help me regain some strength. And then I read to help with my memory fog. Yes, and I think it has helped. But it used to be very, very bad. You forget a lot of details about a lot of things. I'm having conversation with my husband. He tells me something, in 2 days' time, he repeats it. I say, you didn't tell me. And it becomes like an argument. I told you, you didn't tell me, that kind of thing. But I realized that when I started reading extensively, it has helped me out. So basically, you will not get the best quality of life that you had prior to diagnosis. But then it's better to be alive than to be dead.
It is. It really is better. And we thank God that, you detected it early and something was done about it on time. Ladies and gentlemen, we are still having the conversation on breast cancer. Dr. Cynthia is here. We have Joycelyn here. I want you to please send in any questions at all that you have. Our WhatsApp number is 055-157-5757. You can see it at the bottom of your screen at the moment. Please pick it up, go on WhatsApp, message us if you have any questions. Do you have an experience with breast cancer? Have you heard of any myths, anything confusing you about breast cancer? We are here to clear it all for you. So please do not hesitate to send in your messages. And you can go to our Facebook page as well. It is Joy Prime. Let us know exactly what you would love to ask in relation to breast cancer. Doc, now let's run through symptoms of breast cancer. How would you know? How would I know? And I would want you to harness on telling the difference. Yes, you are the pros, so you can easily tell the difference between a lump that is growing that could possibly be cancerous and what is already naturally in the breast. So help us really know the difference.
Sure. So I think that I believe the best person to know someone's breast is yourself.
Is yourself.
Exactly, because you've been with it all your life.
Yeah.
This includes both men and women, because we have men also getting breast cancer. Okay. Sometimes the most common symptom that we see is I feel a lump in my breast. Okay. And it's usually painless. So the lump does not have to be painful before you are concerned. Okay. If you feel any lump in your breast at any point in time, it's best to get it checked out for you to be told, oh, this is nothing to worry about, and then we are all at peace. The most common presentation is a lump. And this lump grows big over time, or it can even stay the same over time. There can be skin changes on your breast, where you notice that the skin on your breast is looking like the peel of an orange.
Oh.
Okay, you see those dimpling
Yes.
on the peel of an orange. We call that peau d'orange. That's French for skin of an orange.
Right.
Okay, you can have that. Other times too, you can notice that there's discharge from your nipple, maybe something bloody, a bloody nipple discharge. It might not necessarily be bloody all the time. Or you notice that your nipple has retracted, it's gone inward. Okay, other times too, you notice that there's an ulcer or a wound on your breast where you've not had anything cut your breast or anything.
Breast.
You just develop.
But before you realize it's okay.
Exactly.
Okay.
Okay, other times you just notice, you stand in the mirror, you see that there's a gross change in both breasts. One is obviously bigger or has become smaller compared to the other, which wasn't so at first. I've also had a few patients who come and tell me that the first thing they noticed was that there was something in their armpits. Okay, like a boil. It's not painful, but they've noticed it there for a while. And then they got it checked out, and then it was noticed that they had breast cancer. So
Yeah, it's funny how sneaky it is. It's very sneaky because it comes with no pain.
Yep.
Yes.
And you can easily just ignore it if you don't take care.
Yes. There are even times where you actually don't feel
anything
at all. And this is just picked up when you do an ultrasound scan or a mammogram. Yes.
Ladies and gentlemen, the entire month of October, I'm reiterating that we are dedicating it to breast cancer. We are going hard on the breast cancer awareness right here on Prime Morning. And so Good Living segment, every single Tuesday in the month of October, we will be discussing breast cancer because there are so many avenues to it that we need to talk about. And God willing, next week, we will be having, a demonstration as to how best you can test to see if, your breast feels different or something. Yes, there's going to be a proper demonstration on live. So maybe somebody would decide, to dedicate their breast for us to do something doctor stuff. Maybe, a lady would decide that, so let me just dedicate my breast to this good cause. Fingers crossed on that. But we are still waiting for you to send in your questions in relation to breast cancer. Joycelyn, now, did you have any fears after you found out? What was the reaction like? How did you feel? How did you have to, rope in, most especially your partner?
All right. So, yes, I had fears.
Okay.
Because sometimes there can be treatment failure.
Oh.
I have nursed a lot of patients who have died with advanced disease.
Okay.
And as at the time I was diagnosed, you hardly see someone come out openly to tell you that I was treated and I've survived it.
Yeah.
So it was difficult getting someone to even look up to. So I was really scared. In fact, I wept. I cried a lot. I had younger children, and the list of them was just 2 years, less than 2 years. So I had a lot of fears. In fact, I didn't know I'd be alive today.
Wow.
Yes. Then, when I was diagnosed and then I started the treatment, I had a little hope, even though I had to hold on to that little hope.
Little hope.
Yes. Yeah. But then when you don't have a choice and the only option is fighting and being strong, you just have to forge forward each day. So my husband was supportive. My mom was my strong pillar too. So with them and then my kids, I just wake up each day and I know that I need to win this battle.
How did you break the news to your children?
Okay, so I called them. Then the first one was just 7.
Okay.
Then 5, and then 1 and
a half. Yeah.
So I told them that mommy is sick and I'll be going for treatment. First, I'll go for admission for surgery and come back. Then I'll be starting a treatment that will cause some changes because I'm going to lose my hair, I'm going to change skin changes and all that. So I needed to psych them up to be ready for all the changes that they'll be seeing. So I explained to them that it doesn't mean I'm dying, but just that it's a treatment I had to take. I know they are too little to understand what cancer is and all that, but then I just needed to have that conversation with them.
Because definitely they would see certain
yes.
and they would most probably ask questions.
Yes. So I actually explained to them about the weakness and all the changes that I was going to experience. I told them. So when it started, they weren't surprised. They were in fact supportive. There are days that I couldn't walk. I couldn't walk without support. And I'll have the 7 years and the 5 years have to, support me hand in hand to just get out of bed or even visit the washroom and all that. So they took it in very well. And they've seen how I have transitioned from treatment. They've seen the changes, the advocacy I'm doing, the awareness I'm creating and all that. And they love it. And they are proud and glad that
we are all proud of your children. Because as young as they were at that time, for them to have easily accustomed to how things were, that was really beautiful. Now, from the time you found out and then treatment starting, what was the period? How long did that take?
Just a month. So
just a month, okay.
I found out first week in November. By 10th December, I was in theater to have my surgery. Then the first week in, I think, January 2020, I started chemo. Then COVID hit, but I continued chemo till somewhere August that I completed my radiation therapy. Then started the tamoxifen, the medication, on 1st of September 2020. So 1st September 2025, exactly 5 years I've been on this medication.
Wow. I found out about, should be a number of months ago that, as a matter of fact, what you see on social media and especially in movies, somebody has cancer, before you realize they're losing their hair and then all of that. It gave this understanding that the moment you have cancer, you start losing your hair. So, but apparently it's the chemo.
Yeah.
The chemo that leads to you losing your hair and all of that. Run us through some of the side effects when you're going through, be it the medications. I mean, she has spoken about the hormonal one and all of that, but the other therapy that you have to go through.
Okay. So for chemotherapy, it works in such a way that it stops or halts the cell cycle. Okay, and that is how fast your cells are multiplying. Okay, so it usually affects cells that are multiplying fast. Okay, and one of those cells is your hair. Okay, your hair cells keep on multiplying. They keep on multiplying. So chemo, as it's halting the multiplication of the cells in the cancer, it also affects your hair and your nails, which are also multiplying fast. Okay, so the hair loss, which is temporary, because as you can see.
Yes.
Look at
she's got full head now.
Okay.
She's braided.
Her hair is grown back.
Yes.
Her nails are looking good. Her skin is gone.
So wait, the nails, what happens?
It darkens.
It darkens.
It darkens.
And it can fall off.
Yes.
Oh, it darkens and it can fall off. Wow.
And now, unfortunately, due to advances made in beauty and stuff like that, you have wigs that you can wear, and then nobody gets to see you're losing your hair. You can do your eyebrows, and then you just move on. You wear your extensions. I mean, everything has been made in such a way that
beautifully cover it up.
Exactly. You can see someone and nobody would know that you are even undergoing chemo or stuff like that. Okay. There's also the nausea and the vomiting, which happens some days after you take the medication. The chemo is such that for what we give for breast cancer, some of them are taking is a dose every 3 weeks. It's not that you take it every day.
Every day.
Okay, so a dose every 3 weeks. If you have to do the maximum, you do like 8 cycles of such. Okay, so afterwards, now your cell starts recovering itself, okay? In the young people, those who are premenopausal, chemo can also affect your ovaries, because it has that, it's also one of the cells, the organs that multiply quite quickly. So it cannot affect your ovarian function.
Okay.
But there are medications and ways to manage that. If you want more children, we can do egg harvesting. Okay. Other times too, we can give medications that can suppress the function of the ovary. And then when you are done with the chemo, your ovarian function can pick up. That reduces the risk of the chemotherapy affecting or causing an ovarian failure. So you have most young people asking that after the chemotherapy, can they have children?
Children, yeah.
It's possible. It's possible to have children after the chemotherapy. Like I said, the egg harvesting can be done, or we can suppress ovarian function, and then afterwards, you get it back. The fatigue, the tiredness, and all that, it's there, but it's not forever. It's transient. So when you're done with the medication, I mean, looking at the greater cost that you're going to get from it, that things get back to normal. I mean, look at Joycelyn.
Some time ago, it looked like cancers like breast cancer were so far-fetched from Ghana. Like, yeah, you know, as for we Africans, as for Ghanaians, there was absolutely nothing like breast cancer. But then,
the story is
look at where we are now. What would you say has changed over the period? What have we done, or what were we missing at that time that made us think that it was so far-fetched?
So gone were the days that we were struggling with only malaria and cholera and typhoid. Nowadays, we are having more of non-communicable diseases, the hypertension, diabetes. We are having a lot of the cancers. And most of it, from data, can be attributed to the westernization of our lifestyles now. Now, we do not eat our usual high-fiber diets and all that. We prefer chicken and chips. We eat a lot of Western diets, okay?
Right.
Now, people drink a lot of alcohol, people smoke, and they see that as a sign of affluence. But all these things are affecting us. Previously, that wasn't our lifestyle.
Yeah.
But now we are moving towards that line. And to make things worse, we are still fighting our infectious, our communicable diseases, and we've added this to it as well. Okay, because our lifestyles have changed. Okay, we are looking more at the Western life as a sign of affluence.
Yeah.
Whatever reason we have, but because our lifestyle is changing, a lot of alcohol, a lot of smoking, which affects the genetic makeup. Okay, they've all increased our risk of, and it's not just breast cancer. We have all sorts of cancers increasing amongst us now. The liver cancer, we have the prostate cancer, stomach cancer, and all that. And now we are increasingly even seeing them in younger people. That's the most alarming thing.
I was going to ask you a question of, what is the youngest age that you have diagnosed with breast cancer?
For breast cancer, I've seen people in their 20s. That is me. And I mean, in my very short time of working now, I'm sure my senior colleagues might have even seen more. That is breast cancer. In other cancers like colon cancer, I've seen 16-year-olds coming with colon cancer, which is scary. It's quite scary. Nowadays, the narrative is changing. It used to be people 50 and above, 60s, and now we are increasingly seeing it in younger people, and it's quite scary. It's quite alarming.
Let's read some messages from our WhatsApp. Let's see what we have. You can also send your messages to our WhatsApp number 055-157-5757. Okay, so we have, is all lump cancerous? I had one, and I was told by a doctor it's a milk duct. Milk dust or duct. How true is that?
So not all lumps are cancerous,
Right.
like I said.
Yes.
Some are benign, which means it's not cancerous.
Yes.
Okay, so if you notice a lump in your breast, the best thing is to get it checked out. It could be from the ducts, like the person who sent the message said, or it could be what we call a fibroadenoma, which is also from some of the tissues of the breast. Okay. Sometimes it could be that something has hit your breast and then the tissue reaction in there can cause a lump. It could be just a fluid-filled cavity, what we call a cyst. So not all lumps are cancerous. But you can't just examine with your hand and say, oh, this is not cancerous.
Yeah.
It has to be investigated.
Yes.
Sometimes you do an ultrasound and then you see that, oh, these features are very benign. Maybe we can follow it up or the ultrasound can say, or mammogram can say, no, this looks a bit suspicious. Let's take a piece of it and have a look at it under the microscope to see what exactly it is. Other times too, we would say, okay, let's take the whole thing out and examine the whole thing and see what exactly it is.
Whew, let's move on. Hi, I'm Prince from Begro. I've heard that you people are here again. You guys have come back. I've heard that sucking on nipples can prevent cancer. Is there any truth to this claim? My darling. I don't know what to say. I don't know what to tell you. We have said it countlessly, even when it wasn't Pink October. We have said it countlessly, but then you know what? You dog, you say it.
All right.
Let them.
Then no woman will get breast cancer.
Sorry?
Then no woman will get breast cancer.
Exactly. You see, that was what I was going to say. That if that was the case, all the fondling, all the sucking and all those things. Doc, please go ahead.
Anyway, so Prince is a male, obviously,
Yes.
so he's probably talking about men or male sucking the breast. Does that not prevent breast cancer? What helps in the prevention is breastfeeding a baby. And that is because during the period of lactation, there's a blockade sort of production of estrogen, which can increase the risk of breast cancer. So it's during that time that you have some protection, and not because anybody is suckling on your breast that's going to bring that.
And even with you breastfeeding your baby, there is still, a slight chance of there being a probable, lump in there or something. So please, let's not get it twisted. Let's be calming down, okay? Let's calm down and let's learn. We are all here to teach each other and learn from each other as well. Let's move on. Good morning. I'm watching live from Hacho. My name is Barbara Dowona and a survivor. It's good for us to share our stories for people to know that breast cancer is not a death sentence. There is hope to survive. Yep. And the hope that Joycelyn shared earlier, that glimmer of hope that she saw, that is what she held on to. And to even think that with her story, she just found a small lump in there, but there was still fear. There was still fear. And so I'm glad that we are having this conversation and that we are dedicating the entire month of October to talk about breast cancer. Even if you get diagnosed and then it is the very advanced stage, you need not worry. You need not worry. Let's take in some more messages. This person is asking, hi, is this the morning show? Yes, this is the morning show. This is Friday morning. It's been 12 years, thanks be to God. I'm Grace Thompson, a breast cancer survivor. Oh, congratulations to you. And we thank God for your life. We thank God for how far He's brought you. Hello, good morning. Please, I'm having an itching nipple. Is that a sign of breast cancer? Over to you, Doc.
So just having an itchy nipple, you can't conclude that it's breast cancer. There are some diseases of the nipple. Okay, sometimes it could just be skin diseases or probably a reaction to something. But yes, it's necessary to get it checked out.
Get it checked.
Get it checked out so that we can make sure if there's something, it can be tackled early. And then if not,
Joycelyn, do you think that maybe you might have, because you spoke of the fact that, to you in your head, there's no history, yes, of breast cancer in your family and all of that. But after you were diagnosed with breast cancer, did you try to deeply find out if there was the probability of history of breast cancer in your family?
I did.
And there was still nothing?
None.
So do you think that you could have maybe done certain things that led to you experiencing this?
Well, no. I checked my lifestyle.
Yeah.
I'm an Eve. We eat a lot of okra soup and fufu.
Right, yeah.
I was not eating the junks like pizza. In fact, I even bought pizza way after I was treated to celebrate my daughter's birthday. It's not something I will usually go and say I'm ordering pizza or chicken or chips. And no. So I wasn't into that kind of stuff. My favorite was banku and kinky. You know, all my friends who know me will say that I for kinky. So if it is kinky and fish and banku and okra soup or fufu, then I don't know. But I didn't live that kind of life that would say that I would attribute it to like maybe me.
Maybe lifestyle contributed to this.
So I just know that from science there can be genetic changes. That maybe you'll be the first to be diagnosed in your family. So it wasn't really explained to me. I don't know what was my risk factor or my predisposing factors. All I know is that I came down with cancer and I've treated it and I'm fine.
Totally fine. We thank God for that. Let's move on and read some more messages. Good morning, please. But a situation where you always get itchiness on your breast, especially around your nipple, and often get swelling during breastfeeding, but you're told there's nothing like that by a professional. But could it be a chance of cancer? I'm breastfeeding a 3-week-old baby, and I noticed a lump and also some sharp pains, but I'm told it's the breast milk. So what should I do?
All right, it could be. But as I said, you do not just sit down and assume, because we've seen people come with breast cancer during breastfeeding. So then again, the best thing is to get checked out, at least depending on your age. Well, since she's breastfeeding, maybe an ultrasound scan, it could be that it's a blocked duct and then you have milk accumulating there. That can happen. But if not, and it's something else, it can be investigated and then we can conclude on what exactly it is. Yes.
Hello, please. How do you differentiate between the cancerous lump and the big normal one in the breast?
So cancerous lumps are mostly it's something that just came into your breast. It wasn't there previously. You just noticed it. That's one thing, and they can get bigger over time. They are sometimes hard, but I don't. The general populace might not be able to tell the difference between how it feels. And then they sometimes can be hard. And then sometimes mobile, sometimes not mobile. But if it gets to the point where it's not mobile, that means things are getting advanced. So you don't have to wait till you see all these things. Immediately you notice a lump, the best thing is just get it checked out.
Do we have some more? All right. So it seems that's it for our WhatsApp messages. Let's see. Let me take this one. Hi, please. With the black spots on the breast, I have it, but hairs are coming from it. Think it's hair pores rather.
Black spots on the breast.
Black spots on the breast.
Spots.
Yes.
Then it's probably hair pores.
And hair is coming out of
probably hair
it's
pores.
probably hair pores.
Probably.
So I think she asked the question and answered it herself. I think it's hair pores rather. So Doc is confirming that it's probably hair pores. All right. Well done, my sister, for sharing your story. May the good Lord continue to strengthen all survivors and grant us longer life with good health. A beautiful amen to that, ladies and gentlemen. All right. So please, like I've told you, month of October, we are dedicating it to breast cancer awareness. And tomorrow is a brand new month. Tomorrow is the 1st of October. And so please, I want you, if you have a story you would love to share, if you are a breast cancer survivor and you would love to come on the show and share your story with us, our arms are open wide. Please let us know that you would love to come in studio and share your story with us. It would encourage somebody out there as well. So please do not keep it to yourselves. Just as the beautiful Joycelyn has come out to share her story, and look at how beautiful she's looking. You cannot even tell. It is not written on her forehead that, she went through this or she went through that. You can't even tell. And that's the amazing thing about it, that when you get tested on time and it's found out on time, something can be done about it on time. But when it gets advanced, it doesn't mean that all hope is lost as well. And so, Joycelyn, thank you so much for sharing your story. We appreciate you this morning. And Doc, thank you so much for helping us, understand the dynamics of this as well. But Joycelyn, before you go, is there anything that you would want to finally say to our viewers?
All right, so we still are losing the fight somehow because of late diagnosis. So this year, our team is catch it early, treat it right, and survive it. So there are people who are diagnosed early, but then will go to other alternative treatments and will come back to the hospital and die. We don't want that.
Yeah.
We want to all rejoice and win this fight against breast cancer. So all I'm saying is that know your breast, be breast aware, know when there are changes, and don't entertain fear of the diagnosis. Even if you are diagnosed, I'm sitting here as a symbol of hope to tell you that all hopes are not lost and that just come to the hospital, the right place, stick to the advice and then of doctors and nurses, and I'm sure you'll be okay.
Okay.